This is how athletes heal faster, and anyone with knee pain can too. Follow me. I'm Dr. Osman, interventional pain physician here at Madison Medical. PRP, might not be too sure exactly what it is, stands for platelet-rich plasma. So take the ability to harness your own blood to heal you, reduce your inflammation, increase your function, and give you the life that you deserve. So join me as we explore how this is done. We have a patient who suffers with about moderate degree of arthritis in his knee. Came in, was not really interested in traditional medicine, which is what? Steroid shots. He's tried physical therapy, he's tried chiropractic therapy, hasn't really done what it needed to do. And the reason why he came to us is because we're the pioneers when it comes to the new regenerative forms of medicine. We have PRP here, which is, as I mentioned, platelet-rich plasma. We have the ability to take blood from you, spin it, separate the blood from the plasma, and then harness only the platelet-rich plasma. What platelet-rich plasma has the ability to do, if injected into the right joints, is burst out growth factors. And there's about 7 different types, which can help stimulate the healing cascade all over again. So once the blood has been finished spinning, and it spins at about 3,500 RPMs for approximately 10 minutes, we then unlock, open up, and then separate our specimen. So as you can see, initially this is all blood. After the spinning, it separates your RBCs and blood from the plasma. And what we're looking for is exactly this portion right here, about 6 mLs right in between the two. What remains is what we call PPP, or poor platelet plasma. We're still able to take the poor platelet plasma, dehydrate it, and then concentrate it and make it this viscous solution that has a tremendous amount of anti-inflammatory markers. A2M, alpha-2 microglobulin, and IRAP, interleukin-1 antagonist protein. So this initial syringe is going to take the poor platelet plasma, and we're gonna fill that up until we get to the final 6 cc's of blood. And at that point, we'll switch out the syringes. We'll attach the one that is going to only take the platelet-rich plasma. So as you can see, we're getting right next to where it's at the 6 mark. Perfect. So as you see, we get closer and closer to where the 2 types of blood are now merging. And if you look closely, there's a white buffy coat. That's where your platelets are. So slowly, you want to try to get as many of them into the syringe. Once we're done with this, what we're going to do is we're going to take that PPP, or the poor platelet plasma, and we're going to start to dehydrate it. So now, once we've attached our poor platelet plasma, we have an empty syringe on this side. So everything is closed off. You have this special filter. It's called the XL-PC filter, protein concentrator filter, that comes from Apex Biologics. Then we create this negative seal or negative vacuum. And now, as I push this plasma to go through the filter, what it's going to do is pull out the water component from the plasma. As you can see, it's dripping into here. So some people ask, like, how is it doing that? The filter only allows a certain molecule size to go through. So the water molecule size is smaller, whereas the proteins are bigger. What we're gonna do is we're gonna keep going back and forth here until we get to the amount that we're looking for, right? So we're about maybe just past 10. So I'm gonna keep going. I'm gonna try to get it down to maybe just under 5. We can take that A2M and inject it into the knee. So we are pretty good. One more pass. So at this point, we'll separate this. That's our A2M, and this is our PRP. So here we have the aftermath. You know, the injection's been done. Patient is happy, been discharged comfortably without any issues. But what did we actually do? Under fluoroscopy guidance, which is this machine here, I was able to identify the entry point for the knee. So there's no poking around to figure out exactly where the entry point needs to be. Once we knew the appropriate depth, we got within the intra-articular capsule of the knee, we then confirmed if we were appropriate with a little bit of a medical dye. And as you can see here on the saved picture, that the dye, this is our needle, that the dye actually spread appropriately. It was getting good spread on both sides. So then after that, we had our injectate, which was the mixture of PRP, platelet-rich plasma, and the A2M. All of that went into the knee, approximately 8 cc's in total volume. Patient left very happy. And we discussed, what to expect in the upcoming weeks. All right, guys, thanks for watching. Hopefully you guys learned something. If you're suffering with any sort of joint pain, nerve pain, and you're interested in the forefront of medicine with regenerative medicine and treatments, go no further than Madison Medical Sports and Rehab here at Madison, New Jersey. See you next time.